A New York lab starts semi-automated testing for the coronavirus disease. Clarence Shaughnessy reports.
A New York healthcare system announced the start of semi-automated COVID-19 testing at its lab outside of New York City. Northwell Health received federal approval late last week to move from manual testing to semi-automated testing, increasing the number of samples technicians can process per day from 90 to hundreds.
With the cartridge-based semi-automated test and the fully automated test, essentially we just have to train people to load the samples and, read the results, run the quality control, and they can go.
New York and Washington, the U.S. states hit the hardest by the coronavirus outbreak, are struggling to make testings for the virus widely available, with local officials estimating it could take weeks more to reach peak testing capacity. Boosting testing is crucial to assessing the scope of the U.S. outbreak and identifying where it is spreading most rapidly. Vice President Mike Pence said on March 4th that roughly 1.5 million tests would be available by the end of that week, while President Donald Trump told reporters on Friday that anyone who wants a test gets a test. But more than a week later, the ramp-up has been much slower due to regulatory hurdles at the federal and state level, as well as logistical and technical challenges, according to healthcare providers, public health officials, and test makers. U.S. Health and Human Services said that currently testing capacity was roughly 10,000 tests per day nationwide.
Until we reach the point where there's enough testing that anybody who has flu-like symptoms coming in could get tested for this virus, just like we test for flu and RSV and rhinovirus and all the other viruses, we are not going to be satisfied that we have enough testing capacity. So we're going to keep going until we reach that point.
Clarence Shaughnessy, UNTV News and Rescue, New York, USA.